Hello, everyone. My name is Shirley Conrad. The following presentation we're presenting to you here to mimic what we did at the American Holistic Nursing Association conference. This is a national conference that was held in June of 2015 in Branson, Missouri. The title is Nurse Coaching in Action, Transforming Healthcare. Next. The panel was made up of 5 individuals. Each of us have a either a business, faculty, or graduate tie with the wisdom of the whole. At the conference, we acknowledge that conflict of interest. However, the intent of the discussion was for nurse coaching, not on a specific program of nurse coaching. So we'll present the following as we did then. Next. Linda will begin with going over the roots of nurse coaching.
Thanks, Shirley. So we have used the image of a tree to give our presentation structure. And I'm going to be talking about the roots of nurse coaching, the trunk, which is going to represent how nurse coaching came into being, this certification. And then we're also going to spend time on the branches because we're often asked, what does a nurse coach do? So people on the panel are going to be sharing how they use nurse coaching in their practices. So let's look at again now at the roots, providing stability and really weaving together the American Nursing Association standards of practice, which are embedded in the nurse coaching certification content, and then we added the American Holistic Nursing Association values, the ones that we love as holistic nurses. Barbie Dossie and I started talking together about nurse coaching, how to bring nursing and coaching together, and how to make what would happen when we have over 3 million nurses working with people, working with their patients and their clients from a position of the client and the patient leading, really getting their needs met, really having them at the center of the interactions. We got very excited talking about how this could really not only change nursing but healthcare, and we'll talk more about that. So we took the standards of practice and the American Holistic Nursing Association core values. We asked some friends of ours, some colleagues, to join us because we knew it was a big project. So we asked Darlene Hess, Mary Elaine Southard, Susan Luck, and Bonnie Schwab to help us. And we met for about 3 years, working with first as a task force from the American Holistic Nursing Association, and then as a task force of the American Holistic Nursing Credentialing Corporation. And we did a lot of work putting together the core competencies. There was another group that I was part of, the consortium, the National Consortium for Health and Wellness Coaching Certification. And in 2010, I believe we had a summit meeting. Maybe it was 11. And so the 6 of us, the 6 nurses, holistic nurses, we're all holistic nurses, put together a white paper. Especially Darlene Hess was the head of that, the point person, and she did a great job pulling together a white paper that was presented to people at the summit. The summit was 70 or 80 people, invitation only, looking at was it useful and necessary to put together a certification nationally. And we nurses were already working on that. At that time, there were chiropractors who were wanting to be coaches, there were pharmacists, so there were a lot in the professions of everyone kind of looking at how they could put their profession with coaching. So over those 3 years, we pulled together a lot of support, and certainly the American Holistic Nurses Credentialing Corporation did the heavy lifting, did the tests, got the tests, first had to do a assessment. Was it necessary for nurses? Did people want this certification? Looked at what the core competencies were, taken from that white paper that then got expanded into a book that was printed by the American Nurses Association called The Art and Science of Coaching, The Provider's Guide to Scope and Competencies. So then there was the test put together, and now there are about, at this point, about 240 nurse coaches that are certified in this country. So one of the things that we decided early on was that we would, that education was an important part of what we needed to have in terms of nurse coaching, credentialing, and that we made a decision that this would not be a specialty but a role that could be in any field of nursing. And so that's what we put together in the art and science of nurse coaching. So now we're to the many branches, providing many opportunities. So nurse coaches can be at the point of care, the point of contact, leadership, nurse training. It's great to have nurse coaches as faculty, because then they're coaching their students, and then their students can coach their patients. Private practice is another place where nurse coaching is abundant. One of the things that's part of nurse coaching is self-care, since it's based on holistic nursing principles, and there are a lot of different kind of specialties that you can use as a nurse coach. Grief and loss, stress management, energy work is another intervention that really works well with nurse coaching. And so the opportunities are really endless. Nurse coaching definition is that a nurse coach is a registered nurse who integrates coaching competencies into any setting or specialty area of practice to facilitate a process of change or development that assists individuals or groups to realize their potential. Nurse coaching is a skilled, purposeful, results-oriented, and structured relationship-centered interaction with clients provided by registered nurses for the purpose of promoting achievement and client goals. So I'd like to turn the microphone over to Barb Schroeder. Barb?
Hi, welcome. We're so glad you could join us on this call. I'm going to be talking about coaching clients to prepare for surgery. My background is that of a clinical nurse specialist in solid organ transplant. The patients I saw were pre or post kidney, liver, or pancreas transplant. Many had been living with chronic illness for a long time. If asked what do they remember about feeling well in their past, they didn't recall anything. They did know that they wanted to go back to a more normal life, which transplant could provide. As part of my practice, I taught a weekly class on using integrative therapies to prepare for surgery. Seeing patients both pre-op and post-op gave me an opportunity to see what effect the surgical preparation had on their post-op recovery. I followed over 200 patients for 2 years. This is what I learned. Powerful questions can help elicit exactly what are the patient's fears and anxieties. It also helps identify when you as a health coach put on your consultant or educator hat to teach patients skills to improve their post-op recovery. Including family members in the skill preparation for surgery helps them partner in a more healing way with the patient post-op. Next slide. Your client has just left the surgeon's office only to find out they will be having a knee replacement surgery in 3 weeks. They have never had surgery before, and they have heard many negative concerns from their family and friends. How will they react to anesthesia? Will they be nauseated? What will their pain be like? How will I get up and walk after surgery? How long will I be in the hospital? Do I need to get physical therapy? All of these questions are on their mind, and they are feeling very anxious about what to expect. They have noticed that each day that they get nearer to their surgery, they notice increased anxiety. How can they prepare for surgery in a holistic way? They were told by a friend that there was a surgery coach here in town. They got the number to contact the coach, and the first session is set up. The client is informed that it would be helpful to come with a list of questions and also their concerns. They can bring a family member with them if they would like, and actually that's encouraged. Next slide, please. Surgical patients arrive in the coaching session with not only concerns and questions, but many experience anxiety and fear about what to expect from the procedure and the outcome of surgery. Clients want to learn skills to prepare for them for their surgery and their post-op care. The powerful questions are a framework to help determine the priorities of your first session. In starting the session, identify how much time we have together and then ask, what would you like to focus on for our time together today? What is your desired outcome from your surgery and post-op recovery? Through these powerful questions, the patient begins to identify what they want to have happen and what they are concerned about. This will then open the discussion to begin focusing on skills and activities they can do to prepare for surgery. Next slide, please. After identifying the patient's focus, the coach can then identify skills which may be helpful to help manage their anxiety and fear. The coach asks the client if they are interested in learning some skills to use to prepare for surgery. The coach demonstrates and teaches the client how to do the anxiety release technique and abdominal breathing. The client is introduced to guided imagery, and a CD is available for the client to listen to. The coach identifies the specific benefits for the client and how often to listen to the CD while practicing their abdominal breathing. Throughout this part of the session, the coach continues to confirm the client's outcomes. The coach asks the client if they have any questions, and if the family is available, assist them in identifying how they can be supportive to the client while doing these skills. At the end of this session, a time for follow-up phone call and next session is identified. Next slide. Health coaching and surgery coaching are really a blending of two approaches. And what this does is it helps to bring the best possible outcome for a safe and healing recovery. Throughout the evidence-based literature, these outcomes that can be anticipated include a decrease in the anxiety level, decreased recovery time and hospital length of stay, decrease in pain following surgery, decrease in nausea and vomiting, a strengthening of their immune system which then enhances wound healing, enhanced sleep, and increased self-awareness and self-control. Next. So, as you work with surgery patients, remember this. If the body is sick, the mind worries and the spirit grieves. If the mind is sick, the body and spirit will suffer from its confusion. And if the spirit is sick, there will be no will to care for the body or mind. Thank you. And Kathy, would you like to go next?
Thanks, Barb. I'm Kathy Zarling, and it's my pleasure to talk with you today about the specific role that I've had with nurse coaching. My background has been with over 40 years in acute care nursing in a large medical center, particularly with cardiac patients, both in the CCU and on the general floor. So now as I move forward in working with people in the community and across the continuum of care, my three areas of specialty are the cardiovascular risk reduction, tobacco freedom, and stress management. Some of the most important points that you've heard as we've spoken today are what it takes to make a coaching experience successful for the client, most importantly, but also for the coach. So what do we do in coaching clients for success? First of all, we need to identify what their primary goal in behavior change is. What is it that they are looking for to change? What is their priority, and what is their agenda? So many times in nursing, we are wearing the hat of the educator, whereby we need to work with our patients in helping them know what's best for them, as we all think, as they go home to recover and get back to their normal life. Working in acute care, my time was often very limited with patients, and so it was most important to find out what their priorities were, because the best laid plans of the health professional can go for naught if the patients are much different. So hearing our client's story, what is it that they want to change, and maybe how do they want to go about it? Ask the powerful questions that we've all alluded to that will facilitate the client's progress toward their self-wisdom and change, and we'll talk more about those. What is it that the patient asks for us what is the patient needs, for us to ask them to move them forward toward their goal? What's worked for them in the past? And in just a minute, I'm going to give you a case study of a typical patient I worked with and talk a little bit about what it would take to help them move forward toward their priorities. But what is it that's helped them in the past? What are their strengths? We really want our clients to build on the strengths that have helped them be successful previously, because this may also help them in the future. What are the next steps they want to take, and what do they choose to do? Many times we'll say what a client or a patient sets out to do as their goal can change quite considerably, and they may find out that they're really looking for something totally different. So some of the questions we ask our patients are, what do you think are the next steps? How do you think you could move forward? Toward the end of the sessions, and remember, we've set the stage, we have an agreement, we have a contract, the client knows from us how many times they'll hear from us. And so at the end of the session, we might say to the patient or the client, what is something fun and easy? What's realistic for you that you could accomplish prior to our meeting next week? And we must always, always remember that the cardinal rule of coaching is that we never lead our patient or our client. We, as a coach, walks alongside of them, a little behind of them, and never leads them, but is there for support. This would be a typical cardiac patient that I've worked with throughout my career, possibly a young individual, and I might add that when I first started cardiovascular nursing, the patients were 60, 70, 80, and now today they're 30, 40, and 50. So let's take a 42-year-old intense accountant who's had a first-time large myocardial infarction and who also is in the hospital for the first time. He's a 2-pack-a-day smoker, and although he's tried to quit 4 times, he's still smoking 2 packs a day. He has a new diagnosis of diabetes mellitus type 2, and he's overweight with a BMI of 38. The patient tells me that, yes, I'm sedentary and I don't get exercise. I have no time to exercise. I work 60 hours or more a week, and then I want to spend time with my family and go to sporting events for my kids. And after all, I have church responsibility and community work. The patient will tell me that their stress level is very high, and although they would like to change, they really can't see what they can change at this point, even though they may have been told by their physician that they must make definite lifestyle changes and now, because it may kill them if they don't. So once again, the patient might say to me, I know I have to make changes to live. How do we help these people prioritize? What are the things that we want for them to look at? And again, it isn't our agenda, it's theirs. So for this patient, I would go in to see him and give him the information up front as to how much time we have together today, but what do you see as your goal, sir, in moving forward and changing your life? Again, he needs to be in the lead. Next, we want to look at very important outcomes, and much like the ones Barb mentioned, there's many similarities. But for a patient who is wanting to reduce stress in their life, reduce their cardiac risk, or try to quit tobacco, whatever their priority may be, the outcomes can be reduction of further cardiovascular risk, decreased risk of further cardiac events, or death for that matter, decreased anxiety and depression, as Barb talked about, increased work capacity. Patients who really feel control over their lifestyle changes and know that they're headed in the right direction will acknowledge the fact that they have decreased symptoms, decreased angina, shortness of breath, claudication, fatigue, or other cardiovascular disease states or other illness states or other symptoms. They feel increased stamina, and they certainly feel a better a control of their life, increasing both their physical and mental well-being. Additionally, they have reduction of stress. They feel they cope better. They certainly feel more relaxed once they're taking better care of themselves, and our overall goal is that they feel an increased quality of life. Something I'd like to leave you with, which is a quote in the book by Michael Stratford on Masterful Questions, is always remember that one of the most powerful things that a coach can listen for in all of our work with our patients or clients is the question that that individual needs for us to ask. It is in this fashion that we will truly be giving the best service to our clients or patients. Always remember, it's not about the brilliance of the coach. It's about the magnificence of the relationship. And now I'd like to turn the presentation over to Shirley Conrad.
Thank you. So for me, in my coaching practice, I use it quite a bit in leadership, and I look at coaching through the lens of complexity. I think a lot of the coaching principles match very nicely with some complexity principles. Next. Three of the things that I think of right off the bat that are complexity principles that are applicable are, one, complex adaptive systems. And that helps me understand that it's neither possible nor desirable to understand the client, that is not my job, nor is it necessary. And I understand that their situation is independent of the coaching process and the coaching relationship. Another one that is very applicable is the idea of being at the edge of chaos. This area is usually thought to be very difficult to maintain the balance, but usually where the greatest outcomes come. So the client can exist on a continuum between stability and chaos, which I think most people could relate to, and that movement on that line is going to vary, and the coach is what can help with that. So the edge is the area that's the most adaptive and the creative has the greatest creative potential. So as you approach the edge, that's where you're going to get the biggest change potential. And it's how does the coach balance order and disorder as the client dances that edge, which I have found to be very powerful. And finally, the butterfly effect, many people have heard of, tells us that small changes can have huge outcomes. And I do see that frequently in coaching, that it's those little aha moments that have been allowed to occur because the client can actually concentrate on what their needs are, what their desires are, that create some really powerful outcomes. And the neat thing about some of the investments that we have in coaching that that might come up, you know, we look at them as what's fun and easy. And so they're small tests of change, and that phrase is used quite frequently now in the clinical setting, these small tests of change. And the idea is that we don't invest a lot of time and effort and energy and money in something until we kind of see if it's going to work. And so that's what happens in coaching relationships. The client will come up with maybe we might call it homework or something they're going to test out. And if they come back the next week and it didn't work, it's not a big deal to let that go. We can try something else. Next. And so, and B, coaching and leadership is something that also flows fairly effortlessly. So in a leadership position in acute care area, I can look for coaching opportunities that are often informal and occur on the run. I do this with tips I might give to individuals, how I communicate updates, how I maybe prompt for action to influence something that needs to happen or change in the clinical setting. I do this by positively role modeling coaching behavior. One of the things that I find most useful is the use of language. So I'm very cautious to have language either verbally or in written form that's inclusive, that opens up the opportunity to see the other individual as completely competent and unique in their own sense, and offer to see what might emerge from their practice that might be helpful to everybody. I pay attention to how I listen. I consistently recognize others' personal strengths. Obviously, in a clinical situation, performance, especially in a critical care area where I work, performance has to obviously be quite high. And so sometimes there might be opportunity to let someone know that maybe something fell a little bit short, but in doing that, you can always recognize all the many things that were exemplary, so that how you communicate that, I think, is important. I also use coaching to enhance my social capital, and that means that all the things that I've already mentioned, all those things that I do is like money in the bank, so to speak. And so when things need to happen quickly or whatever, if you're trying to create motion in work, people are much more willing to engage and proceed because of that social capital. Of course, self-care is always important. There's got to be time for pausing and recharging and looking for ways to create positive interactions with other people. I have to learn to be flexible with goals, taking a fresh look and changing if needed to. And coaching does that, again, because you learn that you're always curious, you're always looking to be flexible, and you don't put all your eggs in one basket might be the best way to view that. So if it doesn't work, it's no problem to change to do something else. And of course, utilizing self-coaching to make personal changes. So my experience with coaching personally is that it really makes you more in tune with the people around you, the way you interact with people, and then you can see changes in others that get reflected back to you. So as far as in a clinical area, it really helps to build a team. And now, Marian, tell us about your experience.
Okay, thank you very much, Shirley. And next slide. So my story is of using and utilizing and enjoying coaching as a terrific fit for a holistic RN to add to her toolbox. And I remember when I first went to a workshop that Linda did, thinking, oh my goodness, this is super. All the principles of coaching seem to fit in exactly perfectly with all the best parts of nursing that I loved as being a holistic nurse. That as holistic nurses know, it's really about concentrating on what's going right with people, what their strengths are, and more of a wellness model than a disease model. And coaching was also a way to look at someone's strengths, to really be a companion on the journey with people, to walk alongside them and to help them discover and uncover their dreams and their visions and formulate a plan to make that happen. And so as I learned that coaching existed and was a wonderful fit for nurses, I got really excited, because that was the part of nursing that I really enjoyed the most anyway, of empowering people and helping them to achieve their goals. And it wasn't about trying to skillfully force someone to be compliant. It was really about helping people discover their own motivation and discover their own inner wisdom for what it is that they wanted to do. So I thought that fit in terrifically with the concept of being a holistic nurse, and the flexibility of coaching, especially coaching over the phone, fit in terrifically with all the other things that I was doing as a holistic nurse. Some teaching, consulting, and to be able to add that in and create a flexible schedule was awesome. And then with my second point of personal growth and development, what happened that was quite interesting was about the time that I signed up for the coaching course, I also was laid off from a job that I'd had for about 14 years as holistic clinical coordinator of a small rural hospital. And that wasn't expected. The hospital downsized quite a bit. And also within a month or two, my father-in-law had a stroke and was actually very, very sick and needed a lot of care for the next couple of years. So I found my life pretty upheaved, turned upside down in a lot of ways. And I discovered firsthand what it was to have the support of a coach to help me through a period of difficulty, because within the course there was quite a lot of peer coaching, and it was really terrific to experience. In the process of learning how to coach other people, and the differences really between being an expert advice giver and a encouraging coach companion, I really discovered and relearned or reused or experienced for myself a lot of tools that were terrifically helpful to me. So it was really a very beautiful experience, and again, it just reinforced to me that what I loved the most about nursing and holistic nursing was being able to help people make those changes that they wanted to make in their life. A couple of years ago, the theme of the Holistic Nursing Conference was Catalysts for Conscious Change, and really that's what I feel like as I'm coaching with people. So there was an integration of my own life with all the coaching principles, and that process just continues. So then if you go to the next slide, what I embarked on at that point was what I call the journey to fun and easy, and to learn how to add coaching to my toolbox, and also now to be teaching as well was just a joy. It's something I find very pleasurable to do, and I really enjoy the opportunities, and more opportunities are coming up. What I found and discovered for myself personally is that this is an incredibly tremendous fit for nurses, health and wellness coaching especially, because we really are so well versed in what's going on with the human body and the human psyche and all of that. And I also just as much enjoy doing life coaching and other kinds of coaching with people too, whatever it is that a client needs. And as an example of how I find coaching works so powerfully, I had a client who was a brilliant young woman who had a high-level security clearance with Air Force, I guess, designing cockpits, and was talking to me about her goals and desires a little bit, and one day just kind of said in a sort of small voice, you know, I really wish I was a yoga teacher. And as we explored that, and I asked her at the end, what a nice, fun and easy next step could be that she could do. She said, well, I guess I could talk to my yoga instructor. I have a class tomorrow I'm going to go to. And so she chose that for her homework. And when she went to the class the next day and mentioned it to her instructor was ecstatic. She said, oh my gosh, I'm going to have surgery in about 9 months. I'm going to need someone to cover my classes. I would love to help you become a yoga teacher. Here, let me do this. Start coming with me to my classes. You can watch what I'm doing. And it was just incredibly exciting, and she is well on that path. In fact, I talked to her just today, and she was designing her business cards. So the beautiful part about it is just the almost the quantum wonderful synchronicities and the power that comes when someone makes a small change and then goes with it. I also was coaching once a woman who had a dream to do a webinar and just felt like, oh, I just could never do it. I have all these ideas. I really should do it, and I just kind of can't get it off the ground. And as we explored what was going on with that, and she just uncovered really what her motivations were, why she really wanted to do it without feeling like she had to, it just turned out to be a beautiful example of what she felt like she needed at the end was just someone to do it with. She wanted a collaborative partner, and it turned out that even though she was a content expert, that we developed this kind of concept where we both had a musical background, so it worked out that we considered her the lead singer, and I was just her backup singer who basically just harmonized with her, sung a couple of grace notes, and just made her sound good as we did this webinar together. And it was just a lot of fun for both of us and a very positive experience that wouldn't have happened had she not had, and not just me necessarily, but a coach to walk alongside her and help her achieve her dreams. So I really find that coaching is, again, a wonderful fit for anyone who loves to see people empowered and has a curiosity and a creative imagination and wants to help people make changes in their lives. And I just feel like that, especially with nurses and this nurse coaching certification that's happening now, we are really at the forefront of an emerging industry and an emerging opportunities that are very exciting. So that's my story, and now I will hand it back to Shirley.
Okay, Linda. Thank you, Marian. Linda, maybe we'll go to the final slide. And so that's something you can look at as I tie this up. So we all joined together to create this panel discussion at the conference with the idea of discovering or discussing how nurse coaching could transform healthcare. So now I'm going to go back through and ask each of the individuals a question related to that. Linda, let's start with you. You didn't actually speak about your coaching experience, but as the founder of a nurse coaching program and obviously as a founder of nurse coaching in general and obviously an entrepreneur with the wisdom of the whole, share with us what your vision for nurse coaching and transforming healthcare is.
Well, that's a great question, Shirley. I think that, you know, early on I saw it as an opportunity for nurses to take a leadership role in really changing how things get done in the hospital. I remember my daughter had a horse injury accident, fell off her horse, got thrown from her horse, and we were in the hospital in Las Vegas, and I saw there was a whiteboard on the wall, and it had goal, and I thought, oh my gosh, they're asking patients about what they wanted, and then the nurse quickly came in and wrote her goal on, and I thought, well, that's great that the nurse wrote her goal, but I thought, wow, what would happen if the nurse asked my daughter, the patient, what was her goal? And so this idea of really engaging people, really helping them get to their intrinsic motivation, really having them drive what happens when they can. You know, obviously, nurse coaching is for times when the patient is able to drive, so to speak, drive the agenda. It just felt like everything would change. I just see it as, and I'm still hopeful that as we get more nurse coaches in the hospital systems and nursing schools, that we'll really have a system where patients' needs are addressed first and more fully.
Thanks, Linda. Barb, you presented two types of coaching, nurse and surgical. How are these forms of coaching similar or different, and where do you see the impact for transforming healthcare?
Thanks, Shirley. That's an excellent question. Actually, I initially was introduced to surgery coaching, and with a background in transplant, it felt really comfortable for me. But what I was finding was that I kind of was leading the clients or the patients where I thought they might want to go, although generally I was fairly good about asking what their questions and concerns were. When I was introduced to Wisdom of the Whole coaching, I realized there was a whole nother way of doing surgery coaching and a blending of both. So I find them to be very complementary, and actually I find they bring a softer, more compassionate approach to dealing with the anxiety and stress of surgery for the clients. They really feel listened to, and they really feel supported. So I really feel for the future, the combination of health coaching, nurse coaching, and surgery coaching is the way to go when dealing with surgical patients.
Okay, thank you. Kathy, you've provided a glimpse of your work with a patient population that's challenged with several comorbidities. Any one of them would be a significant challenge. Individuals with multiple comorbidities are not unusual today and are one of the reasons we have a national call to transform healthcare. So tell us, how do you think nurse coaching can address this?
Well, Shirley, I think one of the first things is the fact that we hear so much today about self-advocacy and self-efficacy on the part of patients, along with the support of their family and their significant others. And so rather than us leading the way as far as what the patient should do, again, it's up to them. It's their agenda, and we want to call on their strength and inner wisdom. So as coaches, if we do this and we walk alongside and help our patients gain the strength that they have to move themselves forward and really enhance their health and well-being, we will be able to look at a difference, hopefully, in the future of healthcare. Another point that I worked with a lot and served on a group in the hospital was in regard to reducing readmissions. And we all struggle with reducing hospital readmissions. But there again, it's not just one thing, and particularly with people, as you said, with many comorbidities, but also with many factors that bring them back to the hospital, be it lack of social support, depression, loneliness, inability to cope with their medical regime, whatever it is. If we meet the patient at their level and ask them what their goals are and really focus in on what they see as priority, I think that'll help us a lot more in trying to keep patients out of the hospital and more in control of their care. And hopefully, again, that this will help us really change the future of healthcare.
Thanks, Kathy. Marian, how did your coaching experience lead to your movement into private practice, and how might nurse coaches in private practice affect healthcare over the next 10 years?
Wow, well, I think that it has a lot of impact, hopefully even before 10 years. For nurses to be in private practice lends a sense of autonomy and gives nurses a voice and I think a real platform, even though they might be individually in private practice, to make some changes that with more freedom than they might have within an institution, and to be able to put nurses on the map of really being high-level, critically thinking agents for helping people really make the kind of changes people are wanting to make right now. And especially with coaching, it acknowledges that people are intelligent. It acknowledges their own inner wisdom. It acknowledges that they can do a lot of the background work for themselves and for their own health care. And acknowledges the wisdom that people can have with a partner. So, and I think people are looking for that. And gradually, the healthcare system is learning, I think, that people are looking for that too. And yet, as we're kind of ahead of the curve as for knowing what it is that people want and what people are willing to pay for and what people are willing to seek out. And more and more as well, nurses of a certain age and even younger are looking for flexibility with their time. They're looking for the chance to create the kind of practice that works with their lifestyles and really provides deep satisfaction and goes along maybe with some of the other kinds of modalities that holistic nurses do. Because a lot of holistic nurses already do have private practices and energy work, and we didn't talk about how well that blends with energy work, but that's part of what I do. And so to be able to put everything together is just a win-win-win for me as a practitioner, for my clients, and so I believe for the healthcare system in general.
Okay, thank you. If I were to answer a similar question, I see nurse coaching transforming healthcare through relationships. For me, the coaching relationship seems to honor the individual's unique journey. So while honoring their capacity to uncover what they need most at every moment in time, I think the coaching relationship will be key in the future to transforming healthcare, very similar to what you all each have said as well. And so we hope the listeners can see that the view of these 5 nurse coaches are each unique, yet complementary in how we think that nurse coaching is going to impact the transformation of healthcare.